would now like to introduce our facilitator, Jennifer Kitson. Jennifer, it is *7 to unmute your line.
Okay, I believe I'm on. Can you hear me?
Yes, I can.
All right, thank you. Thank you, Allie. So welcome to the webinar today. We know that there were over 200 people who have registered, so some may continue to join as we move through this presentation. We're very pleased today to have some speakers that will be helping us learn a little bit about prepared communities and how they can be successful in violence prevention, particularly related to rural communities. I'm Jennifer Kitson, and I work as a technical assistance specialist for the National Center for Mental Health Promotion and Youth Violence Prevention at Education Development Center. We serve grantees that are with Safe Schools Healthy Students and with Project Launch. We also have with us Gina Lasky, a consultant with the WICHE Mental Health Program, and we're very pleased to have Gina. She is a licensed psychologist who's been training and working in the behavioral health public sector since 1997. In that time, she's worked in residential facilities with youth, community mental health centers, public hospitals, and one of the state of Colorado state hospitals. At the state hospital, she worked with men with serious mental illness who engaged in physical and or sexual aggression. Last year, she was the director of behavioral health for a community health organization serving 5 rural and frontier counties in the state of Colorado. As part of that position, she oversaw all crisis services for those 5 counties, and it included working in partnership with local agencies to manage crisis situations. Dr. Lasky is currently a contract consultant with the WICHE, which is Western Interstate Commission for Higher Education, mental health program. She's working with WICHE on state behavioral health systems and integrated care projects. So we want to welcome Gina. We also are very honored to have Ingrid Donato, the Chief of Mental Health Promotion Branch of the Center for Mental Health Services at SAMHSA. She's, for over 20 years, had experience in the mental health field, including working in inpatient, outpatient, community, and research settings. The branch consists of mental health promotion and mental illness prevention, focused grant programs, technical assistance centers, and national evaluation efforts, including Safe Schools Healthy Students Initiative, Project Launch, implementing evidence-based prevention practices in schools, and the Community Resilience and Recovery Initiative. Prior to joining SAMHSA, Ms. Donato supervised staff to oversee operations of the Children's Hospital Boston Behavioral Health Services. She also managed an emergency psychiatric center serving the Metro Boston area, now a suicide prevention lifeline affiliated crisis center, and served as director of an evening program for chronically mentally ill adults, including those dually diagnosed and those with mental illness and hearing loss. She has extensive research background, including research of mood disorders, treatment options in children and adolescents, as well as phase 2 through 4 pharmaceutical trials, and investigating alternative therapies for bipolar disorder, seasonal affective disorder, and PTSD in military veterans. Ingrid will also has given radio talks for urban DC listeners on mental health-related issues. So we're very pleased to have her today. And our final set of speakers for today are Pat Smith and Jan Osborne, who are with a Safe Schools Healthy Students Initiative, Putnam County Schools in Putnam, Ohio. Pat Smith currently serves as project director for Project SAFE, and that is a Safe Schools Healthy Students Initiative. She has over 30 years' experience in education, teaching, and providing curriculum support to Putnam County schools. Dr. Jan Osborne is completing 20 years as Putnam County Educational Service Center Superintendent, has 41 years in education, a strong background in special education with experience and responsibility in all aspects of education. His philosophy continues to be, if it's good for kids, we need to do it. We're very pleased to have a superintendent who is joining us today. And I think let's go to the next slide, Allie. I do want to just mention that this webinar, as well as other webinars in this series and a website, are available to anyone in the public, and these are related to a rural behavioral health initiative for children, for youth, and families. This is an initiative is a partnership between the Child and Adolescent and Family Branch and the Mental Health Promotion Branch for the Center for Mental Health Services and Substance Abuse and Mental Health Services Administration, along with the Western Interstate Commission for Higher Education, the National Center for Mental Health Promotion and Youth Violence Prevention, National TA Center for Children's Mental Health at Georgetown, and the Technical Assistance Partnership for Child and Family Mental Health. So this group has put together objectives for this particular webinar to identify overall trends of rural violence in populations and issues for focus of prevention programming, to help you learn about federal efforts focusing on prevention of youth violence and promotion of mental health, to help learn about how a rural community is achieving positive outcomes for youth through a Safe Schools, Healthy Students initiative, and to share ideas, successes, and challenges of prevention partnerships. So you'll hear information and as well as have an opportunity to ask questions as we go throughout this webinar today. Ali, can you go to the polling question? All right, so please complete this polling question. We want to find out where you are located in the country. We hope that we have representation from each part of the country. Looks like we have a few of you voting, so if you haven't yet, please indicate where you are located. Looks like most from the Northeast Mid-Atlantic, about half right now. All right, and we have a few from the West, Northwest Mountain region, a few from the Southwest, and a few from the South and Southeast. And if I vote, I'm in the Midwest. So, okay. So it looks like about half from the Northeast Mid-Atlantic, but we have representation, none from territories or Alaska, Hawaii, it looks like. Okay, thanks, Ali. Let's go ahead and go to this next question. This is helpful to know your role in your program and community. So please identify what would be most appropriate to your role. And again, we hope that we have representation from all of these. Looks like about a quarter, maybe a third of you are in the other category. So at some point, maybe we'll ask what the other might be. Most of these would be related to either federal, state, or local policymakers. We have about 16%, as well as management administration. And the other could, I'm wondering, be other school district employed folks, perhaps others, it could be family members. All right, so let's move on to the next slide. And I'd like to introduce Gina Lasky, who will talk to us about trends and issues in rural violence prevention. Gina. Gina, if you are speaking, you may be on mute.
And do *7 to unmute your line.
Can you hear me now?
Yes.
I unmuted, but it didn't work out. Thank you. I'm really excited to be here today.
Thanks, Gina.
Okay, Ali, you want to move to the next slide, please? Great. So I thought we could just start off today talking about the fact that I think right now there's really an enormous opportunity and timeliness for talking about violence prevention, and particularly rural violence prevention. As recent events have happened, there's more and more media coverage about violence and what communities are doing. In addition, healthcare reform will offer numerous opportunities for prevention planning, and I think violence prevention within that. And I think people and communities in general, leaders, are really thinking about what solutions they can have in their area and what they could be doing differently. So it's a great time to be talking about this and to be thinking about it. Okay, Ali? So I want to start off by trying to give an overall perspective of violence and national trends in violence. This is data taken from the FBI Uniform Crime Reports. And for anybody who's really interested in the specifics of where I pulled the data, because the Uniform Crime Reports have many, many tables, it's table 18. And I'm going to walk you through the data a little bit and then try to talk about why this is important. So I pulled out a couple of specific populations: urban 100,000 and over, rural under 10,000, and rural 10,000 to 25,000. And what this is reported crimes. And I selected the crimes. There's many crimes that they report on. These are the ones that I selected for this webinar. So the first column of each population is the number of incidents for that crime, and the second column is the rate of that kind of crime in that population. So the rate is incident per 100,000 people. So the second column really allows you to compare between populations. So as you look at that, I just want to say a couple of things. The first thing is that crime across the United States, and violent crime in particular, trend the same. So although rural communities may be slightly delayed in that trend or have lower incidence, the trend is the same. If violent crime goes up in urban areas, it's going to go up in rural areas as well, although the delay may be 6 months, 9 months, depending on the specific crime. But the overall trends are the same. The next thing is that this is really an underreporting of violence in the United States. We know that many crimes go unreported, specifically in rural areas when victims and perpetrators know each other. We know that victims very rarely step forward and report the crime. I just wanted to give an example for that. The National Violence Against Women Survey found that women over the age of 18 reported approximately 1/5 of all rapes, 1/4 of all physical assaults, 1/2 of all stalking perpetrated against female respondents, and these were underreporting because they knew the perpetrator. So it's pretty significant. So I think when I would look at this, I would think about the fact that there's more. Okay, we can go to the next slide. In addition to that, there are really priority populations for prevention in the United States. So this is looking at national hate crime data. And as you'll see, we all know that violence is perpetrated against specific groups more often. And I just want to break this down a little bit more by group. Once again, underreporting, we know people are not always reporting when they've had incidents of hate crime against them, particularly minority groups and especially immigrants, we know do not report. Immigrants are afraid that if they report, they may get in trouble. So I want you to think about that as well. So in the race category, 72% of that 48% were directed against blacks. For sexual orientation, almost 60% of that was against an anti-male. So men who are homosexuals are the primary target. For religion, it's primarily anti-Jewish, 62%. For ethnicity and national origin, it's primarily against Latino populations, again, almost 60%. And the kinds of crimes that are occurring against these specific populations, 29% reported destruction, damage, or vandalism, 22% were simple assault, 12% were aggravated assault, and 29% were intimidation. So although not all of the crimes are violent, you can see a pretty significant chunk were assault. Okay, next slide. So there are some unique issues in rural areas in terms of violence. The first is that there's higher rates of sexual assault and domestic violence for women in rural areas. 7 in 10 rapes and sexual assaults involve a known assailant. So again, the connection between people, and the smaller the area and the more relationship there is, the harder it is for people to report, and also the higher incidence there can be in certain populations. We also know that the closer the connection between the victim and the perpetrator, the less likely the victim is to report. Rural women also have higher rates of domestic violence due to poverty and some of the unique challenges of rural areas. They have fewer health care providers, they have problems with transportation, physical isolation, issues of confidentiality, again, concerns about reporting on the perpetrator, and fear of retaliation. And I think that's a really important piece to think about in rural areas, is how isolated people can be and how that might increase their chances in violence, and how to then have prevention get at some of those challenges. We also know that there's higher rates of substance use. Alcohol use is higher in rural areas. Methamphetamine has been a problem in rural areas across the country. And now we have bath salts propping up across the country, and there's a lot of research showing that bath salts is connected to paranoia, violent crime, sexual assault, and self-inflicted and other harm. And I bring that up primarily because, again, I think in rural areas, although this may be happening everywhere, in rural areas it changes the dynamics and changes the way in which prevention needs to respond, and it can increase some of the problems, particularly things like bath salts. And then the last thing is that there's a higher prevalence of gun ownership in rural areas. Guns don't necessarily mean more violence, but we have seen that prevalence rates seem to go up where people have greater access to firearms. In this particular study, 67% of respondents reported firearms in their households, and 7 of that had a loaded, unloaded, unlocked gun in the home. Okay, next slide. So this is looking, really just giving a snapshot of violence in schools, and again, national data. This is the CDC's YRBS, which is the Youth Risk Behavior Surveillance System, which is a well-known survey that the CDC does nationally. And it's a great survey. It covers every kind of risky behavior, from whether or not youth are wearing their seatbelt to whether or not they're bringing firearm to school. And although they don't break down the data on their website by rural versus urban or very specific populations, you can go to their website and go to the YRBS section and look at your state specifically. I would also encourage people, many states, I know in Colorado, the Department of Public Health has data by county, and you can talk to your state public health department who helps the CDC do the survey, and often you can get county level data and then compare your county to the rest of the state and compare your county to the rest of the nation. So again, I just pulled a selection of questions. This is obviously not the whole thing, but it gives you a snapshot of nationally the kinds of things that youth are reporting. And they do it both in middle school and in high school. So, you know, moderately high numbers. We certainly don't want to think of almost 17% of youth reporting carrying a weapon to school. But, you know, as you look through this, I'd just think a little bit about your own schools and what you know, and then if you're curious, go get some of the data from the CDC. Okay, next slide. So this is some research that's more specific to rural schools. One study found that 25% of the rural youth reporting haven't been exposed to gun violence at least once, and they found that the youth who were exposed to gun violence reported significantly more anger, dissociation, post-traumatic stress, and total trauma. So we know that those incidents, even if they're not very common, have a large impact. Witnessing violence often leads to initiation of substance use, which we know from the previous slides creates other problems because substance use tends to be a risk factor for engaging in violent behavior. And the last is that higher levels of poverty are significantly related to higher levels of direct exposure to violence, dissociation, damaging property of others, and other risk factors for violence. One of the things that one of these studies found was that when kids are exposed to violence of guns, they also reported after that higher levels of violent behavior themselves. So those are the kinds of things that I think rural schools need to be thinking about. It's a higher rate here, 25% of youth reporting they've been exposed to gun violence is a higher rate than what we saw in the CDC. Okay, next slide. Once again, in rural areas, there are priority populations that tend to be targeted more. This data comes from an interesting study. It's the Gleason National School Climate Survey, and it's the experience of lesbian, gay, bisexual, and transgender youth in our nation's school. For anyone who's interested, the link is in our resources section. And it really found that students from the South and Midwest in small towns and rural areas were more likely to have prejudice against them, hear remarks against them, be bullied about gender or sexual orientation, and that they were also the least likely to have an LGBTQ youth or group program. So they're more likely to get targeted and they have the least resources. And important to this is also, I think, to think about that schools are a microcosm of the community. So the study found that the educators didn't respond to these incidents very often. And I would say that that's really reflective of more of a community problem than a school problem. Although schools have a place in solving some of those problems and creating prevention problems for those priority populations, it's really important for communities to look at these as whole problems themselves. And people in the community, if you have a rural community there's a lot of accepted bias towards specific groups, it's going to trickle down into your schools and vice versa. So if prevention programs start in the community, it will trickle down into the schools. But I think that the LGBT population is important for rural areas to be thinking about. Okay, next slide. Then I just want to give a little perspective on school safety, because all this data sounds pretty bad, but actually schools, I think, are pretty safe still. Rates of homicide and suicide as a result of firearm deaths in the United States, obviously the important point here is that most of the deaths, whether it was homicide or suicide, involved firearm. So again, the access to firearm is important to consider, and thinking about your community and how much firearm there is there, and then how to build prevention programs around that or help people educate around that. Less than 1% of the students, though, who had homicide or suicide rates, this happened at school. So most often, again, it's happening in the community. Next slide. This is just continuing that same theme. Only 1 in 2.5 million is your chance for having a school-related homicide, whereas you're far more likely to have a motor vehicle accident. So although it's something we should be concerned about, it's not the highest rate incident that we're having. And most school homicides, again, involved a firearm and involved a single victim and offender. And most of the school incidents, the weapon was obtained from home or from a friend or relative. So again, I think the connection to the community is really important to think about, and the connection to firearm. It doesn't mean firearms themselves need to be the focus, but how do we educate communities about how to keep firearms safe, and how do we educate them about the risks that happen when kids can access them, even though the rates are low, when they do occur, they tend to be deadly. Okay, next slide. Just quickly want to touch on the pros and cons of rural prevention. We all know rural areas have unique challenges. They have greater geographic distances between resources, fewer medical facilities, fewer providers for physical health and mental health needs, higher rates of poverty, and lack of funding. Within that, I think there's also macro pros and cons and challenges impacting prevention. At the macro level for challenges, I think part of it is that nationally violent crime is generally viewed as an urban problem, and that because of that, many of the grants and prevention programming resources have been geared towards urban populations, and that there's just a general lack of resources for rural areas. However, I would say, having worked in rural areas and partnering with people, rural communities have a huge advantage, which is that they're used to partnering with each other. They're used to reaching out to agencies in their area and saying, this is a problem, we have to own this problem, which piece is mine, which piece is yours, let's work together to solve it. And I think that that's a really unique part of working within rural areas, is the fantastic collaboration that can occur and the willingness to do that. Okay, next slide. I'm just going to quickly touch on a few partnering models that could be helpful, give you enough so that each of you would know which ones you would want to go back to. The respite care link here, many of you may not be thinking about respite or crisis care, but this is a really great resource for anyone who's new to building partnerships. It's general enough, it's sort of a manual of how to build a coalition. And it's general enough that it could be applied to any issue. And it really is a great tool for beginning to understand important components to think about and how to move through building a coalition. The Washington Coalition of Sexual Assault Programs, Sexual Violence Prevention in Rural Communities is a presentation online that really goes through the challenges and strengths and issues to be aware of in creating violence prevention programs, particularly for women in rural areas. Next slide. So here we have some school violence partnering models. The Health Curriculum Analysis Tool is a CDC tool that really helps guide schools in trying to figure out what curriculum they want to develop, and it includes violence prevention. School Health Index is a self-assessment and planning tool that schools can use, and one of the topics they cover is violence, and I think that's a helpful first step, particularly for schools. And then the 3 bold steps for school community change is really a toolkit that is for community leaders and educators to build schools where students thrive, and based on the Safe Schools, Healthy Students initiative. And then Jennifer's organization has put together, the National Center for Mental Health Promotion and Youth Violence Prevention, put together a great resource list for educators and families to help children around traumatic events. And next slide, I think that's it.
So far we do not have any Q&A submissions. So if anyone would like to unmute their phone, doing *7 if you have a question for Gina. Gina, thank you so much for your wonderful presentation. And if you think of something later, you can just ask later as well. You don't have to ask now. So *7 to unmute your line. Okay, so it looks like we don't have any questions just yet, so we will turn it over to Ingrid.
Hello, can you hear me?
Perfectly.
Oh, wonderful. I always mess up on unmuting. So thank you. My name is Ingrid Donato, and I am very excited to be here speaking with you all. Before we get started, I wanted to jump into polling question number 3. Please indicate the issue you are most concerned about in your community. And please do not be shy about weighing in on this. No one knows what you're selecting, and this is incredibly helpful to us. I always love all the opportunities that we can have to hear what issues are most important to you and your community. So just click the little circle next to the color that responds to what might be most important to you and your communities. And it looks like substance abuse is a big one, bullying. And I know there's a lot of you that aren't weighing in. Come on, don't be shy, no one knows. All right, great. Well, it looks like domestic violence, substance use, bullying, all important topics. Those are obviously topics that are very important to us at the Substance Abuse and Mental Health Services Administration. So why don't we go ahead and jump on in. Next slide, please. So I am the Chief of the Mental Health Promotion Branch within the Center for Mental Health Services here at the Substance Abuse and Mental Health Services Administration, or SAMHSA. Now, within our branch, our focus, and we are a small part of SAMHSA as a whole, but we want to create and foster environments, homes, schools, communities that are safe, that support optimal development, and that are free of violence. I'm going to take you to the 30,000-foot level, and I wanted to let you know a little bit about what's going on at the federal level. Now, SAMHSA's mission is to reduce the impact of substance abuse and mental illness on our nation. So obviously, we are very in tune with your particular issues that you had raised in our polling question, and we are guided by the 8 strategic initiatives that you see in front of you. And you will notice that the first 2, prevention and trauma and justice, clearly show SAMHSA's commitment to addressing issues such as the prevention of youth violence. And we want to change the paradigm of fixing problems after they have occurred to creating environments that reduce the chance of problems occurring in the first place. That really is the essence of prevention. And we want to be able to provide the nation, provide the communities with the tools that you need to help have this happen where you are. We want to be able to provide research. We want to be able to provide best practices and funding and everything that we can do to make your work a little easier. Okay, next slide, please. Now, as a grant-offering public health agency, we accomplish much of this work by providing funding opportunities to communities in need and to those that show innovation. Now, within the Center of Mental Health Services, there are a number that support the prevention of youth violence and the promotion of mental health, and a number of them within my branch in particular. You will hear in greater detail about one of these programs by our next speaker, and I have a suspicion that there are a number of you that are on the call call right now who are grant recipients yourself. So we start with the youngest, the pregnant moms and infants within a program called Project Launch. Now this is a 4-year grant program that targets children from birth through 8 with the goal of all children to reach social, emotional, behavioral, physical, and cognitive milestones. We want them to really look at all of those. We know that healthy growth in each of these areas builds the foundation for children to thrive in school and beyond. Grants are awarded to a state with a community selected to pilot policies and systems changes to increase access to screening, assessment, and referral to appropriate services for young children and families, the expansion of culturally relevant evidence-based prevention and wellness promotion practices in a range of settings. We want to increase integration of behavioral health into primary care settings. We want to improve coordination and collaboration across disciplines and to increase workforce knowledge of children's social and emotional development and preparation to deliver high-quality care. Rural environments are particularly important for this because you already have to work very strategically to get services provided in unique places. It could be quite a far distance between a child's pediatrician's office and perhaps anyone, the next person who could see him for therapy, anything like that. So you're really poised to do some great work through Project Launch. You have already, and that funding opportunity exists for other communities and states that might be interested. Now we next move to those kids who are entering school in a grant program called Implementing Evidence-Based Prevention Programs in Schools, or PPS for short. Now, funds are provided to schools for workforce development in the evidence-based prevention program called the Good Behavior Game. This is a classroom management tool that is implemented in the early grades, typically in first and second grade, sometimes kindergarten, and we've been expanding it out a little bit after that. And it's used to help kids develop pro-social skills. This extensively researched program has shown that if implemented with fidelity in the early grades, kids will experience less suicidal ideation, less substance abuse, less tobacco use, less conduct disorder, will be less likely to develop anti-personality disorder, will be more likely to graduate and achieve higher grades when they are in high school. Now, this is pretty pivotal that we can put in this program in when these kids are at the very youngest ages that will help to reduce youth violence as they grow older. It's very profound. Now, as we move along the developmental continuum, we have the Safe Schools, Healthy Students Initiative. Launched in 1999 in response to a number of school shootings, the Safe Schools Healthy Student Initiative is an unprecedented collaboration between the Departments of Health and Human Services, via us at SAMHSA, the Departments of Education, and Justice. So far, since then, grants have been awarded to 365 local education agencies across the nation. This successful initiative harnesses the power of schools, local agencies, and community partners to ensure that students feel safe in schools, free from violence and bullying. Students avoid drugs, alcohol, and violence. Students have increased access to mental health services, and students don't feel isolated. I am so thrilled that our next speaker will discuss this program in greater detail. Now, SAMHSA offers a number of other grant opportunities. The Garrett Lee Smith Youth Suicide Prevention Grant Program aims at reducing the devastating impact of suicide among those aged 10 to 24. There are many recipients that are in rural environments. We have a lot of tribal recipients as well in all of these grant programs. The National Child Traumatic Stress Initiative, whose mission is to raise the standard of care and improve access to services for traumatized children, their families, and communities throughout the U.S. This really is a very amazing grant program where we're able to really get a lot of lessons learned about how to treat trauma in children. Native Aspirations is another funding opportunity that's been offered through SAMHSA that helps tribal communities address the devastating impacts of bullying, suicide, and substance abuse. The Systems of Care provides grant funds to create a network of effective community-based services and supports to improve the lives of children and youth with or at risk of serious mental health conditions and their families. Systems of Care build meaningful partnerships with families and youth, address cultural and linguistic needs, and use evidence-based practices to help children, youth, and families function better at home, in schools, in the community, and throughout life. Okay? Now, these are just a sampling of the grant opportunities that have been offered by SAMHSA. And what we're trying to do next, in addition to all of this, is to work with states directly to help them create robust prevention infrastructures within the states that really looks at the needs of the communities within each state through our state prevention policy academies. We bring together state leaders for an intensive couple of days, a lot of work beforehand and a lot of work afterwards to help them to develop the policies, the procedures, the supports, the mechanisms to create prevention infrastructures within your state. We have also recently created the Office of Behavioral Health Equity, which coordinates agency efforts to reduce behavioral health disparities for diverse populations. Now, SAMHSA doesn't do it just through grant programs. There are other opportunities to get help in your communities outside of applying for grant programs, which is always a great start. We do this through a number of places, including our technical assistance centers. Now we have one of our wonderful technical assistance centers, the National Center for Mental Health Promotion and Youth Violence Prevention, who are facilitating this webinar, as well as the National Center on Safe and Supportive Learning Environments, which provide a wealth of information to the nation. This is not just to grantees, but this information is available to anyone who is interested on a variety of topics, including youth violence, gang and school violence, bullying, substance abuse, as well as emerging issues such as health care reform. Please visit these technical assistance centers. You will find webinars, you'll find resources, you'll find a wealth of information to help you. Next slide, please. We also work together across federal agencies to share thinking, funding, planning, and best practices. The National Prevention Strategy, which is a key guide of the Affordable Care Act, was released in 2011, and it aims to guide our nation in the most effective and achievable means for improving health and well-being. The strategy prioritizes prevention by integrating recommendations and actions across multiple settings to improve health and save lives. The strategy identifies 4 strategic directions and 7 targeted priorities. The strategic directions provide a strong foundation for all of our nation's prevention efforts and include core recommendations necessary to build a prevention-oriented society. Now, these are recommendations not only to federal agencies, but to states, to communities. There's something in these strategies that everyone can do to help advance the efforts of prevention. The priorities provide evidence-based recommendations that are most likely to reduce the burden of the leading causes of preventable death and major illnesses. And one of the things that I find so reassuring and so wonderful is that they have emphasized that mental and emotional well-being is critical to reducing preventable death and major illness. Another initiative is the National Forum on Youth Violence. And as Gina mentioned earlier, violent crime is generally viewed as an urban issue, and the National Forum was launched specifically for these. These were launched in urban centers, but what we're learning is that we can get a lot of the information that has been collected for this initiative can be used in a variety of different communities. So it was launched by the Department of Justice under the direction of President Obama, and it aims to build a national conversation about youth and gang violence to increase awareness, drive action, and build local capacity to more effectively address youth violence. Now, as I mentioned, it started off in urban centers, but we are learning a lot that can be translated to rural environments. It models a new kind of federal and local collaboration, encouraging its members to change the way they do business by sharing common challenges and promising strategies through comprehensive planning and coordinated action. SAMHSA partners with Justice, Education, HUD, and many other federal agencies to provide direct support to those cities significantly impacted by gang violence, and we're expanding it all the time. Now, SAMHSA also works with the Department of Justice and the Administration for Children and Families to support the Defending Childhood Initiative, which seeks to address the devastating effects of children exposed to violence and as victims and witnesses. We also support StopBullying.gov. This is the federal repository for information, resources, and best practices on bullying prevention. And if you haven't had the opportunity to go to StopBullying.gov, please do. I think if you have any concerns, and a number of you have mentioned this in the poll about bullying in your community, this is an excellent place to go to find a wide variety of resources. Okay. Next slide, please. Now, after Sandy Hook, the President called on federal agencies to develop a plan of action. As he said, we won't be able to stop every violent act, but if there is even one thing that we can do to prevent any of these events, we have a deep obligation, all of us, to try. And try we will. He will soon announce the launch of a national dialogue to increase understanding about mental health. The sense of shame and secrecy associated with mental illness prevents too many people from seeking help. Communities across the country will engage in conversations about this important topic. There will be a number of social media events that will be launched with this, and we're really hoping to have a really great conversation to change how people perceive mental health and to really break down those barriers that are up that get people to not seek help. He has outlined a number of proposals, a number of proposed initiatives in his plan. Now is the time, including $55 million for Project Aware, which aims to reach 750,000 young people through programs to identify mental illness early and to refer them to treatment. This is something that we have been working on extensively here at SAMHSA, and there are two components to Project Aware. One of them is $15 million to provide youth mental health first aid training for teachers and other adults who interact with youth to help them detect and respond to mental illness in children and young adults, as well as $40 million to help school districts work with law enforcement, mental health agencies, and other local organizations to ensure students with mental health issues or other behavioral health issues are referred to the services they need. Project Aware really builds on the learnings from the decade-long federal partnership of the Safe Schools, Healthy Students initiative, which has successfully decreased violence and increased the number of students receiving mental health services. So when you see this down the road, and we're hoping to get the message out extensively, know that this really has foundations in the Safe Schools, Healthy Students initiative. The Departments of Justice and Education also have initiatives within this plan. Justice intends to put up to 1,000 more school resource officers and counselors in schools, and to help schools invest in safety through a new comprehensive school safety program, which will help school districts hire staff and make other critical investments in school safety. The program will give $150 million to school districts and law enforcement agencies to hire school resources officers, school psychologists, social workers, and counselors. Department of Justice will also develop a model for using school resource officers, including best practices on age-appropriate methods for working with students. Also, the plan also wants to give schools and other institutions a model for how to develop and implement reliable plans. Departments of Education, Justice, Health and Human Services, as well as Homeland Security intend to release, and hopefully by May of 2013, so coming up soon, a set of model high-quality emergency management plans for schools, houses of worship, and institutions of higher education. So 3 specific different targets, along with best practices for developing these plans and training students and staff to follow them. In addition, the Department of Homeland Security, in coordination with Justice, will assist interested schools, interested houses of worship, and interested institutions of higher education in completing their own security assessments. Okay? The Department of Education also proposes to use $50 million to help 8,000 schools create safer and more nurturing school climates. SAMHSA is working very closely with both Justice and Education to ensure that these initiatives support and enhance one another, and we're also trying to do the best we can to make applying for these grant opportunities as easy as possible. Okay? The President is also issuing a presidential memorandum directing the Centers for Disease Control and Prevention and other scientific agencies to conduct research into the causes and prevention of gun violence. Okay. Now, this is just a sampling of what is happening in the federal government to address youth violence issues. Please visit samhsa.gov, grants.gov, whitehouse.gov, and Justice and Education websites to find out what opportunities are available to you. Okay? We are all working on these now. These are plans and proposals, some that are going to be starting now, some that will be rolled out in 2014. There are many opportunities for rural communities, including funding opportunities to support rural health information technologies being offered, I believe, by the FCC to improve the quality of health care available to patients in rural communities by ensuring that eligible health care providers have access to telecommunications and broadband. Now, this is, I believe that they have $400 million in funding available, and if you want more information about any of the opportunities that I've talked to you about, my contact information is at the end of the presentation. I will be happy to talk to you a little bit in more detail about it. So please feel free to drop me a line, or if you have any questions that you would like to ask right now, I'd be happy to answer them. And know that we care very deeply about rural environments, and we want to do everything that we can to provide you and your communities with as much resources and assistance as we possibly can. Thank you.
Thank you,
Ingrid. Thank you so much.
Yeah.
So we don't have any questions that have been submitted through the Q&A box. So if anyone has a question, please press *7 on your phone to unmute your line. And if not, that's okay too. Okay, let's keep moving forward then. So we're going to go on to our do we have a question? No, it's probably Ingrid. Okay. So let's go on to our fourth and final polling question. What level of community engagement in violence prevention does your community have? None. We have not started any engagement. Second option, limited. We have ideas, but are not sure how to get started. Moderate. We have started some engagement activities. And then lastly, optimal. We have consistent community engagement. It looks like we have answers across the board, but most of them being moderate. Moderate community engagement. Give it a couple more moments. Okay, that looks like a pretty good spread. So, Pat and, one more second. Okay, let's keep moving on. Pat and Jan, I turn it over to you. Please press star 7 to unmute your line.
Can you hear me?
Yep, you sound great.
Thank you very much for the opportunity to present what we've been doing with Project SAFE. But one of the things that we wanted to talk about, just briefly mention, is we're very happy to have Project SAFE with our Safe Schools, Healthy Students initiative, and this is our 5th and final year for this, but we want everybody to know that this didn't happen just through Project SAFE. The results that we have and what we're going to share with you today, this has been an ongoing effort in Putnam County. Next slide, please. Just a little bit about Putnam County. We are in Northwest Ohio, and we have 9 rural school districts here, and we also serve 3 parochial elementary schools, serving over 6,500 students with 400 teachers and 35,000 residents in Putnam County approximately. And if you notice, we have 16 villages in the county, but we have no cities in the county. And as Jan would tell you pretty soon, he'll tell you how many traffic lights we have in the county. The ethnicity of the county is interesting. Basically, most of our county would be Caucasian, but we do have a high percentage of Hispanic people living in the county and multiracial. And they're all in one section of the county. The rest of the county is basically German Catholic heritage or Mennonite. So we're dealing with 3 different areas of culture and working together with that area of culture. We have a changing population. When I first moved to the county, basically it was very middle class, some upper class, very minimal low socioeconomic, and as the years have gone by, we are moving more and more into the low socioeconomic, and and more people coming in that live here for a little while and then move on. And so we're dealing with something that's different for us. And in the past few years, the largest plant in the state of Ohio that made TV tubes closed, so 2,500 people lost their jobs. This was probably 7 or 8 years ago, and then 5 years ago, we were hit with a major flood. And so it's been kind of devastating, and the economy is just working its way back. Jan?
Well, here's the really important data. Our county is about 450 square miles, and we have 10 traffic lights in our county, so you can see we're really progressive here and quite large. I just have a couple basic comments, and then we're going to do, say, a third presenter. But I don't know about in your area, but those of us who've lived and worked in the same area, oftentimes we have the experience that you can be born here, that's one thing, but you can move into Putnam County and live here 70 years and you're still viewed as an outsider. And there's this idea in our county that those of us who are approaching senior citizen age, that life is still as it was in the 1960s. If anyone can recognize Ozzie and Harriet lifestyle, that's what we still see is happening in Putnam County. We're not quick for change. We don't prefer change. We like things the way it is. We don't want that 11th traffic light if we don't need it. And we have what we think is a very stable environment. And whenever we've witnessed a problem with a student or something in our community, there's a quick thought like, well, they must be a move-in. No one from the county would do that. So You know, we have this perception based upon our belief system that is often incorrect, obviously. And one of the things I want to introduce our third speaker here in a moment, Dr. Staci Richtner. And before we have her give you the real information on data, I just want to share with you one of the things that we are strong believers in because of the process we've gone through with the 5 years of the grant, but the team that put it together, the core individuals put together, worked 3 years in putting applications together and gathering data, the power of data. And one of the things that we really recommend to all of you is don't do what some of us have done over the years. Don't do what some of us have done over the years and go on assumptions. Collect data and look at your data and use it to guide your way. Also, Staci can address the idea of the power of the logic model. As our federal project director officers will attest that we grumbled a lot about logic models in the beginning, but I am a convert. I really believe in following our logic model. Dr. Richtner is from the Center for Evaluating Studies from Bowling Green State University. I would recommend that you find an excellent independent evaluator to help you guide through this process. The thing that Staci has done for us, she's always brought us back, and I'll say it one more time, the power of data, use your logic model, and make decisions based upon those components. And I think you'll see the difference between what she'll share with you about the real world in Putnam County and a perceived world by some of us that have lived here and want to see it in rose-colored glasses the way we want to see it. So I'd like to introduce Dr. Staci Richtner.
Hi, can you go to the next slide? Thank you. Putnam County has actually always been a data-rich county. They, long before I became their evaluator, they were giving the pride back in the 1990s and doing a lot of focus groups on top of that, so not just quantitative but qualitative data. I came on to the grant writing team for the Safe and Healthy Schools grant at the end and just did more of the polishing as far as in looking at what data that they wanted to look at. So was part of that team at the beginning, and that helps if you're an evaluator to kind of actually look at the data and be part of that guiding setting up the logic model. That really is an advantage. Part of what they did to prepare was their community comprehensive needs assessment that was part health department data. It also looked at the PRIDE, so student data, as well as doing additional focus groups and really kind of getting both a quantitative and qualitative examination of what was really going on, and found, and I don't think it was a surprise though, Jan, that they were higher than the national average in alcohol usage kind of across the board at all grade levels. If you looked at it closely, it was specifically looking at beer, and it was just part of the culture, and really having to kind of go against the grain on those cultural issues was going to be a major factor in how they implemented programs. And it really came down to really getting 9 separate public school districts and 3 parochial districts to buy in. And part of the way they did that was, for instance, when they chose an alcohol prevention program, they looked at several evidence-based programs, and then they had them present to professionals from all the school districts, and then those school districts voted and were part of the process. So they did a lot of kind of choosing programs and looking at things by committee, which really helped with the buy-in. And really when you're looking at across 9 school districts, that is a critical factor. The other factor, at least in the counseling, that was also clear. You know, they have one main counseling center within the county, and, you know, as far as I'm also from a rural county, and, you know, everybody knows if you go to that counseling center, there's very few secrets in the county. But having that school-based counseling, and also it wasn't what I call more label-based counseling. It was, since it was school-based, parents and students were much more likely to go see the counselor because it wasn't a full diagnosis kind of counseling that would be set up traditionally through community counseling as well. So, but there was also good partnership between the schools and the mental health counseling areas. So it kind of helped take away that stigma that happened within rural settings that, was definitely a barrier when they started this. And they also had very good collaboration. We absolutely agreed as far as the advantages of rural prevention efforts because they had good collaboration efforts from the start and really kind of just built on those efforts to really look at the data. And one of the things I will say as far as looking at the data overall, one thing we had to be really good about is targeting data for audiences. For instance, after the election, the national election, where I don't think we could watch TV or pick up our phones for almost a year, we did a presentation called "Are we better off 4 years than we were? Are we better off now than we were 4 years ago?" And looked at our data for the past 4 years and our prevention efforts. So that was kind of geared towards kind of what we were all going through. But when we have school-based reports that schools tell us what information they need and what the format they want to see. We take the data back to the students. We have Did You Know, kind of universities call this stall news, where you have things, but we had monthly Did You Knows. One was about bullying, one was about suicide, one was about alcohol use, to really kind of take the data back to the students as well, which I think sometimes is missed when you are providing data to the community. If we were working with mental health agencies, we did drill down data of our mental health data, if we were looking at alcohol. So we really kind of focused on different areas and then did drill down data to kind of look at that more critically. So that was, I think, another way that really helped us. And as well as our core management team, law enforcement, judicial, safety, education, mental health, really helped in getting the word out, and were partners every step of the way as far as looking at the data, helping implement the programs, and really kind of providing feedback as far as what's working and what's not working. So that was also an absolutely critical piece. I'll hand it back to Pat.
Okay, the next slide, please. And what you're going to see in the next 3 slides is we kind of broke it down between our school engagement, our youth engagement, our family engagement, and our community engagement. And as you look at this, one of the things that we gave every year were school climate surveys that we're giving, and every student in the county basically completed these school climate surveys, as well as we gave some teacher-based surveys so we could see what the school climate was by the students in the school, and then also look at the climate of the school from the teacher's point of view. And one of the things that Staci and I did is we visited every school once the data came back and met with that superintendent and their leadership team to go over the data. So the school owned the data, and they were able to see what students and teachers were both saying to see if everybody had the same opinion about what was going on. In the event of the shootings that we've had lately, we've provided several ALICE trainings. The schools have, at first ALICE was looked upon as, no, we don't need that, we're rural, nothing's going to happen here. And now they can't schedule enough ALICE trainings. They're constantly calling and asking for more of that. But one of our more important parts that we did with the school engagement part is the school-based mental health counseling. we have 2 full-time mental health school-based counselors that work in the 9 districts and the 3 parochials, as well as a contract through our community mental health agency here. They go into the school, and what we're finding is we're meeting the students there, and we're meeting their needs, where parents who could not or would not take them to counseling or could not afford to pay for the counseling, their students are receiving that help right in the school. Staci talked about the teacher training and the embedded ownership, about how we selected any of the programs that were happening in our buildings. And then recently this year, we were just asked to participate in a pilot study of the good behavior game. And as Joyce knows, our federal program officer, I keep saying we have more teachers want it. They're seeing results, and that's just been in the past few months that we've been going through with this program. We were able also to add bus cameras and security cameras to the to all of our schools. So we felt secure both ways. We're working mentally for security, and we're also working physically for security, the tangibles and the intangibles. Next slide, please. This is, as you know, is based around youth, and you know you can't always just talk to the youth. The youth need to be actively involved. And as you can see on here, we have many activities that we do with the youth. One of the latest activities that we've been doing the past couple years is called the Video Challenge. And if you go to our website, we have some of the videos up that the students are doing, but they're picked topics that have to do with issues that we have in the county. And one of the last topics that we had that one of the schools chose that we are showing, and that is on our website or is on our site, is the last school did something on suicide. And we're really looking at the fact that if the message is coming from the students will be paying more attention to it. Once again, it's not a talk to, it's a part of. They are part of the resources that we have that we're using with our students and with our community. Next slide, please. Family engagement, we're starting at the young age because the sooner we can find the problems or that we can help prevent problems, the better the results are going to be for the parent and for the child. We have incredible years, wraparound. One of the unique parts of what we're doing is we actually have what we call a home visitor who works with the parents who are having parenting issues by going into the homes and modeling behaviors with the with the children, and then the parents work on it and the visitor comes back, and it seems that the parents are really liking this because they're in their comfort zone and it's easier for them to accept change. Truancy Mediation is something that we have right now that we know will continue, that we have after the funding. We have mediators that are trained to go into the schools to work with the school and the parent over a mediation or a truancy problem the child is having. And what we did with this process is all of our mediators are volunteer mediators. No one receives any money to mediate, and they go to the school, work with the child's teacher, and many times it's the teacher who learns the most because they're not aware of where the child is coming from and the problems that the child has at home. Insight is another one of our programs that we have. As we've mentioned before, alcohol has been a major concern in the county, and we have, if there is a violation of alcohol policies in the school, we have originally our alcohol ATOD person would go in and work with the students. Now all of our schools require that the parents come and be part of it. So it's kind of a two-way now. It's a family engagement in that process. Next slide, please.
this is just our basic slide as far as our coalition, as far as the people at the table when we look at our different issues, at our data, and how to solve problems. I mean, it goes from business to law enforcement, justice, elected officials, public safety, mental health, social services, parent, community members. So really has a variety of actively engaged agencies and stakeholders to really solve the issues that we've seen through the data. Next slide, please.
Okay, in the community engagement part that we have, if you notice, we're talking about policymakers. While we do not lobby our policymakers, we do have packets that we have prepared that when we meet a policy maker, a legislative, whether it be federal or local level, we talk about what's happening with safe schools, and we talk about the results that we're seeing through safe schools, healthy students. And it's kind of interesting because we're saying right in the beginning, we're not asking for money, we're asking for you to see these results. We're asking that you look at what's happening here and how this could be a model and should be a model for other areas. Our mental health providers and our CMT and our committee that meets monthly talking about safe schools and excuse me.
Pat has lost her voice there. I'm going to jump ahead a little bit. And I don't know if it's a cautionary thought or not, but sometimes when people have need, they look for funding. And I would caution people, they don't want to be a solution looking for a problem to be funded. And Pat's point about not looking for money is crucial there. One of the other things that is certainly insignificant, and we thought we understood this, but became more apparent as we developed our relationships, is to build communication and trust. And the old adage that God gave us 2 ears and 1 mouth, so we need to listen twice as much as we speak, has been great advice to me. Dr. Richtner is probably the first person to say this on a consistent base. She kept saying to us to speak with one voice, and she kept referring us back to our logic model. A lot of times people like me would see something on 20 or 60 Minutes and say, hey, you hear about this great program, shouldn't we be doing that? And Dr. Richtner come back and say, now let's look at about our activities stated in relationship to our logic model. Is that something we're supposed to do? It's like, no, it's not, I guess. Okay, now you got me back on target. But again, it's about relationship and understanding the task at hand. Pat just reminded me about having the right people at the table, and I think we'll go to the next slide if that's all right. We head back to trusting. It's hard when we talk about safe schools, healthy students, for people in public schools to think beyond the walls of the school. And so to say that this was a community initiative initially was in theory but not in reality. But as we build our relationships and listened, one of our greatest advocates is our juvenile judge. And as we approached our last year here, he said, we have to continue this. What are we going to do about mental health counseling? So he says, would it be all right if I sent a letter to every school board member sharing with them my positive experiences with the activities of this initiative and encourage them to continue on? And he wrote that letter and received many positive responses back. We also had a local superintendent. We've had financial problems in Ohio for school funding like many other states. And the superintendent said last summer, he said, I'm struggling here. I know that mental health counseling, which I initially thought was not necessary, is a very important service to my students. But how do I say to teachers that I have to reduce the number of teachers, but I'm going to spend more money with mental health counselors? And the answer we all shared was, you have to put the dollars where the need is, and hope your staff understands that. His board has agreed to continue funding next year mental health counselors, which we see as a major victory. Another thing, I think Pat's getting her voice back, but hopefully she won't mind me to share, our emergency management group came to us, and and talked to us about communication. And the acronym is SMARCS Radio. Don't ask me what that stands for. But I knew that they're very expensive radios, and they started saying, don't you think your school buses and every administrator, and there should be so many radios in your 9 local districts, over 100-plus radios, and they're saying, well, maybe we can buy that for the schools out of our 911 levy money, which is a couple $100,000, and that's significant in a small county. That's something they initiated and brought back to all of us that we hadn't even thought about. So we're seeing this partnership go forward, and as Pat said previously, is that our table, we have more and more people pulling up around the table now than we had previously the first 4.5 years, and they want to continue this on. So I probably said too much, but Pat has her voice back. I want to hand the phone back to Pat.
I just want to say that what we found is that in the process of not asking for money, we had people coming to our table saying, we need to talk about how we can help you. And I think that that's a big thing is we're working towards the table is getting bigger, that we need more chairs. Our last CMT meeting, our committee meeting for the Safe Schools, we had to continue to bring in extra chairs because people are talking about the services and they're talking with each other. We're not duplicating services now. We're in the process. We're aligning our services and we're aligning working in the community. One of the other, real quick, I just wanted to add to your newspaper needs to be one of your best friends. Lots of times to my technical assistance person, John Rosiak, and to my federal program officer, I'll send newspaper articles because we have a newspaper that is more than willing to support us, and they always are wanting activities and things that are happening and writing it in a positive way. Never asking for anything. They're just sharing with what's going on. I really think that, you know, as we look at this, and I'm going to turn it back over as we talked with Jan, where we're talking about the lessons learned, one of the big parts about this is remembering that what we're doing is not a grant that begins and ends. It's something that continues. It's an initiative, and it's something that needs to continue to grow, and we need to continue to work with that, and that's pretty much what our community is saying at this point in time.
This is not Jan, this is Staci again, the evaluator. One kind of quality indicator I noticed as well at our last CMT meeting was that they voted to continue to meet after the grant was over. They had other issues they wanted to collaborate on, as well as continuing the programs and services that they had really valued within the grants. One of the probably best things that the grant did at the beginning was chose programs and services that could be sustained. One of my first questions when I looked at their grant was they still had money they could have, additional money they could have asked for within the grant, and they only asked for 2 mental health counselors. I said, well, you have more money that you could ask for. You can ask for more than 2 mental health counselors. And Dr. Osborne had said to me, well, I think that's the amount that my county will be able to sustain after the program's over. And, you know, credit to him, that actually ended up being almost exactly right as far as they look like they're going to be able to sustain both the counselors as well as training of the trainers model. You know, they train trainers and then the schools can provide the services. So they chose a lot of programs and services that could continue without the grant dollars, and that really has made a successful program. I've worked with other places that when they write a grant, that's not what they think of automatically, and when the grant money ends, the personnel go away and the programs and services go away, but really kind of thinking ahead to that kind of mindset has really helped them be successful, and I'll hand it to Jan.
Next slide, please. What we're looking at are what we still continue to see as challenges, and the big part is we're still looking at that big picture, But at the meantime, we need to be putting our pieces of our puzzle together, and we need to be putting them in their places, and I can't stress enough communication. Communicate, 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 and if it's mental health you're talking to, then your mental health person needs to do the talking. I'm the project director, but I am by far not the person who does all of the talking, does all of everything. I kind of facilitate, and let's let the people who know what they're talking about talk to the other people. Planning for sustainability, we're working with our people and working with funding. We even had approached the county commissioners. Ohio's just introduced casinos, and they're sending money to the counties, profits to the counties, and we visited the county commissioners and tried to put a little bug in their ear that might be a wise investment of their casino money if they worked with us with the mental health. And so they're looking at the idea. It had never been proposed, anything like that before. So I also would say we're probably never afraid to try something new, because if we know if we don't try it, it's not going to happen. And that our goal is to do what's best for Putnam County. Jan has a couple closing comments.
Well, we first want to thank all of you that's taken the time to listen this afternoon, and also I want to thank Ingrid and Gina for their excellent presentations. They're very difficult to follow after their excellent work. I just want to also share back the point Pat just made, is listening is so crucial, and trust. And our juvenile judge, he has a small fund, and he's waiting to see what the appropriations will be this year. He wants to fund wraparound services with that fund. He's volunteered that, as well as trying to help us get funding. Our mental health county program is looking at resources they're getting to see if they can support additional mental health clinicians. And I guess one of the things that's easy for people like me to say is trust, but in reality is that some of us are sort of territorial. We're not willing to trust as much as we would like to think that we would. And I think this has made me a better person, a better administrator, to go through this process and see that it happens. And the last thing I'll say, and we'll turn it back to Pat or back to central control here, is that, you know, if we can do it in Putnam County and make a positive change, you can make a positive change where you're at too. So with that, we'll turn it back to you.
All right, Jan and Pat, thank you so much. So we have a couple questions that have been actually submitted to me, so I'm going to read those out before we open up the phone line. So our first one, and they're directed to our last presentation here, and we only have about 5 minutes left, so we have to keep that in consideration as we're answering. Our first question is pretty simple. What are ALICE trainings? So Jan or Pat, that would be you. And star 7.
Okay, yeah, we had to figure out the phone again because we had muted ourselves. Basically, it's the training, and I can't tell you what the total acronym is, what it stands for. But what it is, it's teaching teachers how to work if a shooter comes into the building or someone with violence tendencies. It's not having the students line up in a row to be shot at or in a way that they could get away from the shooter. It's teaching techniques for both teachers and students or adults in the building to maybe lessen what could be a lot worse.
Okay, great. So if you want to stay on the line, our second question is, how are you dealing with the concern that school-based mental health treatment leaves out the valuable insights and input from parents?
I'm sorry, would you repeat that again?
Sure. How are you dealing with the concern that school-based mental health treatment leaves out the valuable insights and input from parents?
Well, one of the things that we work with, and while the students are being counseled in the schools, there are also available services that could be recommended for the parents at that point in time. The parents must sign a release for the students to be counseled, and at the same time, if there are more issues, which many times they're finding that can end up going into the wraparound services, that can go into other services that are provided in the county.
Excellent. Okay, we're on to our last question, submitted through the Q&A. How are you seeing the, I don't know if I'm pronouncing this correctly, the OVEAS
training.
OVEAS, okay, impacting girls? I was recently at a training, and they discussed that girls engage in violence and bullying for different reasons, and so this training was not a tool to be used for girls. What is your perspective on this? Or has it been working for you?
Actually, we haven't looked at that as just a training that hasn't affected the girls. Staci, you would have the data on OVEAS training.
We've really kind of focused when it comes to OVEAS training. I know, absolutely, just looking at the literature, bullying for boys versus girls is quite different. We look at verbal versus indirect versus physical versus cyber. And one of the other interesting things, too, is in a rural county, you hear so much on the news and everything about cyberbullying, but by far, that is the least type of bullying our students report. But you're really looking more at the verbal and the indirect bullying with the girls, and it really depends on the grade level. We've tried to focus, especially with OVEAS, on that implementation integrity piece as well. You can have a great program, but if you don't have that implementation integrity, that you're not going to see results. We have seen bullying actually increase over our years and then has started to drop as well, and I think part of it is the awareness piece, as well as it just being a really hot topic as far as what students are talking about. The one thing I would caution when it comes to OVEAS is it seemed much more geared towards the younger grades. I know they're branching out to the older grades, so really doing, if you can, something supplemental in junior high and high school. I know they're working on branching out, but I don't think it's the I think it has been effective at our schools, but I think you really have to tailor what you're doing, especially at that higher grade level, because no program, even if it's evidence-based, will actually hit all our topics. I think pairing that with our mental health, school-based mental health counselors has been excellent, especially for students that are victims of bullying, so as well as the instigators. So really kind of pairing our different programs to kind of find the most effective results. And it's interesting as far as, especially with school-based mental health counseling, I think our biggest piece has been teachers have really bought into this. Even if their students are leaving for a brief amount of time from their class, which is very important, but they really have bought into, okay, I will have less distractions in the class if the students actually are doing that school-based mental health counseling. So really kind of pairing programs.
Thank you
okay,
so much.
Great. I have one last question. It's actually a pretty quick one. And while I ask this, I have the survey up. So if you have the time, please take it now. But I will also be sending it out in a follow-up email for you to fill that out. And it's great information for us to make our webinars better for you. So our last question is, have there been any threats within the school, such as the school shooting threat, that you have handled?
Threats.
The ones that I remember hearing about, I think we had an incident where they thought a parent might come in. We had an issue there, and actually not in Putnam County, but near Northwest Ohio, we had an issue where a grandparent actually took the children out of school and actually killed them. So, I mean, that has been on a lot of minds and looking at, I don't know if we have any like list-based hey, we created a kill list or anything like that recently. So, but I would not say that it's never happened within the 9 districts.
Okay, thank you. So we're going to wrap it up here. If you have any questions at all, I will be sending out the presentation slides, but we have the contact information within that the PowerPoint slides, which were sent to you already, that you can contact directly, or you can email them to me, and I will direct them to where they need to go. So, Jennifer, if you don't mind, I'm just going to wrap this up, And thank you, everyone, for attending. And again, please let me know if there's any questions.
All right. Wonderful. Thanks, everyone.
Thanks.